The treatment of a frail myeloma patient has been always challenging because the concept of frailty by itself is quite difficult. It's not only about comorbidities, it's about the performance status, it's about the nutritional status, it's about the psychological status, the social environment, the family environment, autonomy, cognitive function. So you can see it's a multifactorial parameter process, which makes it actually very difficult. I'm not convinced we will have soon a smartphone app that would allow us to handle how to manage these patients. But I think based on what we already know from real-life clinical practice, based on the different clinical trials performed in the elderly population, there are some key founding principles, I would say. First of all, this population is very sensitive to toxicity. So we need to be careful. The more is not always the better. So in another word, assessing the frailty, the fragility of these patients is a key step. And we need to pay attention to spend some time really assessing these patients. That's one point. We should not also ignore that frailty is a dynamic process. So we may have patients presenting a diagnosis in a bad shape, but actually when you initiate a treatment, when you get rid of the disease or you improve the condition, actually their general status is going to improve, and then you can use maybe better therapies. You can add drugs. So being careful about the safety issues is crucial. The more doesn't always translate into the better. Having said this, on the other hand, we need to pay attention and clearly select those patients who are elderly but fit, because in these patients actually we can deliver highly effective treatments which can lead to very prolonged progression-free survival and overall survival. And this is exactly what we see with the use of quadruplet and their success thanks to the IMROSE trial, thanks to the CEPHEUS trial, where obviously in these elderly but fit patients, we are able to achieve very long PFS. And it is likely that these patients will need maybe 1 or 2 lines of therapy during the natural history of their disease. So you can see the field is moving into different directions, but they go together actually. If you are fit, although being old, and can tolerate the treatment, then let's push, because then we will, I think, generate a lot of benefit in terms of outcome with good quality of life. If a patient is frail, moving slowly in a gentle manner, it's like a marathon, you know. So you can also achieve long-term outcome. So today we are at an era where every single myeloma patient can benefit from an effective and safe therapy. Actually, although we don't speak about it like this, we have already reached in myeloma the era of personalized therapy. And I believe this is a huge achievement thanks to the effort of all stakeholders.